Mental health challenges like PTSD, depression, bipolar disorder can absolutely strain any relationship. And many couples misunderstand how mental health symptoms can influence relational behavior. These misunderstandings can absolutely lend itself to every conflict, emotional distance, or frustration that you experience. When we have a better understanding of what's happening as it pertains to the mental health symptoms, you have better clarity and understanding and ultimately closeness. I am Dr. Sheena Glover. I'm a couple psychologist. And if you find this kind of conversation helpful to you, please go ahead and subscribe to my YouTube channel. And don't forget to turn on your notifications. I post weekly videos about relationships, intimacy, and navigating non-traditional dynamics with nuance and depth that you wouldn't otherwise see in social media. How does mental health actually affect relationships? So when you think about what's happening for that individual who has PTSD, bipolar disorder, depression, they are struggling with emotional regulation. What I mean by that is that the nervous system is either shut down or on high alert, depending on what kind of struggles you're having. So symptoms can range from being emotionally withdrawn, mood instability, irritability. Unfortunately, these mental health symptoms can actually translate for the other partner to misinterpret them as being a lack of effort or a lack of engagement. When you're in a relationship with someone with PTSD, their perception of their environment is very much dictated on whether or not they perceive themselves to be safe or not. Even when yourself, as the other partner, perceives a situation as neutral, your partner with PTSD very well might not and feel it very threatening. And so it starts within them an activation of hypervigilance, feeling on alert and feeling panicked and thinking about worst case scenarios. All of this can hijack their ability to stay present with that partner. Understanding how trauma symptoms or depression or anxiety shows up in the relationship or shows up within that person, you then have a better clarity of what they're actually struggling with. Mental illness can absolutely change the way that the relationship operates. What I mean by that is that when one partner is struggling with an intense bout of bipolar manic episode, or they're going through a re-traumatization of what happened and that they are feeling really activated, it puts the other partner into a caregiver role. And there is no prescribed amount of time that that's going to last. And so it changes the way that the roles show up, where maybe it was more equitable and equal in the relationship in terms of tasks around the house, who's initiating what. Well, when mental health issues become the prevailing force for one partner, it definitely monopolizes the other person's ability to show up or what they have to do to take care of their partner as they're struggling. When these moments happen, this is where the recipe for a lot of conflict occurs, meaning that there is a lot of emotional disengagement. There's unpredictable mood swings. And for the partner that is in the caregiver role, they don't, without having a thorough discussion, they don't know where this is coming from. So what is the natural course on how to change this? Well, first, it's so important to be able to separate the parts of the relationship that is because of the mental health versus the relationship issues itself. And that can be sometimes very easy to do, and other times it can be really hard to do. So what I like to help couples with is to first understand if they have a diagnosis of depression, what does it look like for them? How do they know and experience depression or PTSD or bipolar disorder? Because what they experience is typically a really great signal to the partner to look out for these symptoms. When you have a cluster of symptoms, you can typically guess whether or not this is a direct result of the mental health issues, or it could be because of something else. So separating the condition of the mental health symptoms from the person is one of the most important steps when you're in a relationship with someone who has severe mental health issues. The second part is encouraging collaborative support. And what I mean by that, even though mental health symptoms resides in one partner, both people feel it, but in their unique way. The person who has the mental health issues are constantly battling an internal battle that is not oftentimes visible to their partner. And simultaneously, the other partner notices and has to adapt. And if both of you are working towards carrying this mental health issue and these challenges together, instead of it being the sole responsibility is that one person, it actually helps to create compassion, understanding, and clarity in the relationship. And then also, it is very important that when you have collaborative support, that the entirety of the support can't be your other partner who doesn't have the mental health issue. You want to expand and extend your support system, aka create a village, through a therapist, psychiatrist, knowing when and where to have check-ins, having coping strategies ready to go. This creates an environment where both people are actually taken care of. And the final place is making sure you have healthy boundaries. Supporting your partner's mental health does not mean that you sacrifice your own personal well-being because you want to be a good partner. A relationship with boundaries allows for the relationship to thrive. So if your partner is having a difficult mental health day, that's okay. And it is okay for you to not have all the answers, that you're not a therapist, that you can't be the psychiatrist. This is outside of my wheelhouse. Let's get us some extra support, because that is exercising really good boundaries. If you want to go deeper, go to my website at intimacyinprogress.com. And if you haven't already, subscribe to my YouTube channel so that you don't miss future conversations like this.